The Canterbury District Health Board has its eye on the future. As we start to plan new hospitals, it's time to take the conversations about healthcare, service delivery, and both clinical and patient expectations to a new level. How can we provide the best care possible? How do we make the journey better for patients and their families and the CDHB staff?
We've set up a range of 9 principles, if you like, overarching principles around health, the sorts of elements of health that we'd all expect to be delivered in a high-performing health system. And we have given those principles to the design team as a bit of a starting point, if you like, and to bring those to life in a facility design.
With the principles in place, the next step was to ask people what they want.
I, as a patient, what do I need when I'm in hospital? How do I feel when I'm going to get there? We came in with things I want to be secure. I want to feel secure. I want to know that people that are looking after me will communicate with me in my language. I want to know what's happening to me in my day. I want to know what my plan of care is.
The challenge here is how do you provide an environment from the patient to feel safe in? How do you provide an environment that they have dignity in their stay?
At the Design Lab, user groups from both Burwood and Christchurch hospitals met to distill thousands of ideas down to core concepts. The teams thought through patient needs and mocked up areas particular to those needs. Ideas became cardboard models. These were then used to identify the strengths and weaknesses of the concepts. Some of the ideas for Christchurch Hospital included angled beds, so you don't have to see your neighbour. Hoods over the bed, remove ambient noise and let you feel cocooned. Everything the clinician needs is on the right-hand side of the patient in bed. There is space for the whānau on the left-hand side of the patient. Ensuite bathrooms. Storage space. Then a high-fidelity ward was built and real-life hospital scenarios simulated.
If a patient had a cardiac arrest, what does that look like for the team that have to attend that patient? So does the bed space work in that scenario?
So Mrs. Smith is a 57-year-old lady. She's got a background of asthma over the last 20 years. She's also a smoker of 50 a day. And she has presented last night acutely short of breath. She's been that way for about 3 days with a cough, productive of green phlegm. She's been hot and cold, but we couldn't really get a temperature last night. So she's been on oxygen overnight. So she had a high white cell count and her blood count, and her CIP was raised as well. We did a chest x-ray, which has actually shown some shadowing at the left base. We think she's probably got a complicated left lower lobe pneumonia on top of her asthma.
Care has to be person-centred, and a person who comes into hospital isn't just a disease. They have there's a whole lot more to them than that, and what we're trying to do is keep people well by acknowledging that what's important to them. Principles underlying the design are about the patient, and that's what a hospital's about.